Hello, I'm Marty Caniglio. Welcome to a special Los Angeles edition of American Health Front. Today, we'll explore how Arjun Reyes, MD, and Associates is using TMS to help patients find relief from treatment-resistant depression. We'll also learn how Dr. Andrew Smith carefully plans body contouring after major weight loss, and how Vital Vein and Vascular treats vein and artery conditions affecting circulation. Plus, Dr. Alexis Furze explains treatments for nasal obstruction and chronic rhinitis. C-Smiles Dental provides comprehensive care focused on long-term oral health, and Dr. Dawn Barati discusses fat pad augmentation for pain beneath the ball of the foot. Depression affects millions of people, and for many, medication alone is not enough. At Arjun Reyes, MD, and Associates in Moorpark, California, Dr. Arjun Reyes has spent more than 2 decades helping patients find relief through advanced, evidence-based treatments, including one that does not involve a medication at all.
We began offering transcranial magnetic stimulation, or TMS, in early 2009 when very few psychiatric practices in California were providing it. Since then, we've performed thousands of treatments and seen it make a meaningful difference for patients who had tried multiple medications without finding real relief.
I've been coordinating TMS treatment since our practice began offering it in 2009. It's been an incredible journey. I've had the privilege of seeing thousands of patients who struggled with depression begin to smile again, reconnect with their family and friends, return to work, and enjoy life again. Being part of those transformations is truly rewarding. Every patient reminds me of why we do what we do.
TMS is an FDA-approved non-invasive treatment for depression. Using the NeuroStar Advanced Therapy System, focused magnetic pulses stimulate targeted areas of the brain involved in mood regulation. The goal is to activate those areas and help restore healthier brain activity. Unlike medication, TMS does not affect the entire body. It is highly targeted. Patients remain awake and alert during treatment. The first visit takes longer because we map the precise treatment locations and settings for each patient. After that, sessions are about 20 minutes. Most patients come 5 days a week for about 6 to 9 weeks, and treatment is generally well tolerated without the systemic side effects often associated with antidepressants.
The NeuroStar Outcomes Registry, which is the largest registry in the world for depression, indicates up to an 83% response rate and 62% remission rate. 78% of adolescents showed clinically meaningful improvement in FDA submission studies. The landmark STAR-D trial found that only about 1/3 of patients achieve remission with their first antidepressant, and success rates decline with each additional medication tried. For patients who have been through that cycle, TMS offers a genuinely different path.
For patients who feel like they have exhausted their options, TMS can offer hope. It is not a quick fix, but for many people, it has helped open the door to real, lasting relief.
While TMS offers hope for people with treatment-resistant depression, Dr. Arjun Reyes believes protecting mental health means recognizing problems before they become serious. One of the most common and overlooked is burnout. Although the program grew from what frontline clinicians experienced during COVID, burnout reaches far beyond healthcare. Left unaddressed, it can contribute to anxiety, depression, and mental health decline. Roughly 65% of nurses and 57% of primary care physicians report burnout, while more than half of employees feel burned out at least some of the time.
Dr. Chris Thompson and I began developing this program after seeing clinicians become exhausted, detached, and disconnected from their purpose. Burnout is more than stress. It is emotional exhaustion, detachment, and a loss of meaning.
Burnout usually builds quietly. Workload can play a role, but so can the pressure to fix, perform, and carry everything. Recovery begins when we learn to care deeply without carrying everything.
The Beyond Burnout program teaches practical tools to help people move from feeling forced to finding flow, restore energy and connection, and build a healthier, more sustainable way to live and work.
When burnout progresses into clinical depression, treatments such as TMS may become an important part of recovery. Prevention comes first, with treatment when needed. Burnout is common, but recovery is possible.
To learn more about TMS therapy at Arjun Reyes MD and Associates, visit reyesmd.com. For more information about burnout recovery, visit beyondburnoutprogram.com. After significant weight loss, many patients feel healthier and stronger, but still feel frustrated by loose skin, breast deflation, and changes in body proportion. At Andrew Smith Plastic and Reconstructive Surgery in Orange County, Dr. Andrew Smith helps patients understand their options after weight loss with a focus on safety, natural-looking results, and careful surgical planning.
One of the most important questions we get after weight loss is the timing of surgery. Before surgery, we ideally want a patient's weight to be as stable as possible. If someone is actively losing weight or if their weight has fluctuated too rapidly, it can overall have a negative impact on the healing, scar quality, and long-term results. A lot of patients have questions about liposuction versus skin excision surgeries to solve the problem. Many times liposuction underdoes the overall result as it doesn't remove any extra skin. After weight loss, the skin has typically been stretched beyond its elastic recoil and simply won't bounce back. That's why the surgery has to be planned around removal of extra skin in the most aesthetic fashion. The goal is to not make someone look overdone. The goal is to restore body proportions and create a result that looks natural and a very aesthetically positive result. This can involve a combination of procedures such as a tummy tuck, lower body lift, brachioplasty, thigh lift, and breast lift are the most common procedures we see. Strategic scar placement is an important part of the plan in order to maximize the aesthetic result and minimize the appearance of scars.
I love how everything came out. Like I said, when I spoke to Dr. Smith, he just reassured me, answered my questions, and gave me an idea of just what was going to happen. When I chose him, I not only wanted someone with experience and skill, but someone who just respected and supported and answered my questions and made me just feel super comfortable in just what I decided to do for myself.
At Andrew Smith Plastic and Reconstructive Surgery, post-weight loss body contouring is approached with careful timing, customized planning, and an emphasis on balanced, natural-looking results, helping patients move forward with greater confidence. Leg symptoms are easy to explain away. Pain, heaviness, swelling, visible veins, cramping when you walk, or slow-healing wounds can sometimes point to a circulation problem. At Vital Vein and Vascular in Orange County, Dr. Christopher Yee and his team help patients get clear answers about both vein and artery conditions. Dr. Yee is a board-certified vascular surgeon who provides comprehensive vascular care throughout Orange County.
At Vital Vein and Vascular, we treat a full range of vascular concerns. Some patients come in for varicose veins or spider veins. Others are worried about leg pain, swelling, open wounds, or peripheral artery disease, also known as PAD. Vascular care is not just cosmetic. Visible veins may be part of the concern, but we also evaluate blood flow to determine whether there is an underlying vein or artery problem. We explain the findings clearly and build a treatment plan around each patient's needs.
That evaluation often starts with vascular ultrasound, which allows the team to better understand how blood is flowing through the veins or arteries.
Once we understand the cause, we can talk through the options. For vein disease, treatment may include venous ablations or sclerotherapy, with minimal downtime for many patients. For arterial disease, including PAD, treatment depends on the severity of symptoms. PAD can cause pain or cramping with walking, numbness, slow-healing wounds, or more advanced limb concerns. It is important to recognize this in patients with diabetes, a history of smoking, high blood pressure, or high cholesterol. Early evaluation is important because vascular disease can progress if it is ignored and may significantly impair mobility or lead to limb loss. For more complex needs, we also provide vascular and endovascular care involving the carotid arteries, aorta, dialysis access, and limb preservation.
Varicose veins and PAD are two common reasons patients come in, but Vital Vein and Vascular also treats a broad range of vein and artery conditions. The practice combines personalized evaluation, minimally invasive treatment options, and coordinated surgical care when needed.
Our goal is to give patients clear information and a plan that makes sense for their condition. When a higher level of care is needed, We have surgical privileges at local hospitals, allowing us to continue guiding patients through the next step of care.
At Vital Vein and Vascular, patients have access to comprehensive care for vein and artery conditions throughout Orange County. If you are experiencing leg pain, swelling, visible veins, cramping when walking, slow healing wounds, or other circulation concerns, contact Vital Vein and Vascular to schedule a vascular evaluation. Do you struggle with a stuffy or runny nose, snoring, headaches, poor sleep, or sleep apnea? These symptoms may come from nasal airway obstruction, chronic rhinitis, or both. Dr. Alexis Furze explains how 2 in-office treatments use temperature-controlled radiofrequency to address the source with little downtime.
Patients rarely come in saying they have nasal airway obstruction. Instead, they describe symptoms like difficulty breathing through their nose, trouble exercising, or poor sleep. Many assume these breathing problems are caused by a deviated septum and that surgery is their only option. Oftentimes, there are other causes like narrowing of the nasal valves or enlarged nasal turbinates that restrict airflow and make it difficult to breathe. These issues can be treated with minimally invasive in-office procedures. One of these options is Vivair. This treatment uses temperature-controlled radiofrequency without incisions in order to gently remodel the tissue contributing to nasal airway narrowing. Studies have shown that Vivair provides symptom improvement comparable to surgery, but with a faster recovery.
A constant runny nose, postnasal drip, throat clearing, or congestion that does not improve with medication may point to chronic rhinitis. Although this is a different problem, it can also be treated with a minimally invasive radiofrequency with a different device called Ryanair.
With chronic rhinitis, nerves in the back of the nose can become overactive and signal the overproduction of mucus, even without infection or an obvious trigger. The condition may or may not be related to nasal allergies. Ryanair uses temperature-controlled radiofrequency to treat the posterior nasal nerve region. The goal is to directly reduce those overactive signals so that medication may no longer be needed. Long-term studies show that the large majority of patients have significant lasting improvement with Ryanair. All patients should start with an evaluation with a nasal and sinus specialist to determine whether symptoms stem from a blockage, chronic rhinitis, or both. This way, we can be sure that the treatment matches the underlying cause.
Dr. Alexis Furze helps patients identify the source of their nasal symptoms and find treatment options designed to improve breathing, sleep, comfort, and quality of life.
Later in the show, we'll learn how fat pad atrophy on the bottom of the foot can cause pain and how cushioning can be restored.
When someone is dealing with back or neck pain, it can be hard to know when surgery is truly necessary. At Premier Orthopedic and Spine Group, Dr. John Attenello helps patients understand their diagnosis, review their options, and make decisions based on their symptoms, exam, imaging, and goals.
As a fellowship-trained and board-certified orthopedic spine surgeon, I treat the full spectrum of spinal conditions, from minimally invasive spine procedures to complex reconstructive spine surgery. One of the most important things I tell patients is that an abnormal MRI does not automatically mean you need spine surgery. Imaging is just one part of the decision, but it has to be considered along with the patient's symptoms, physical exam, and response to appropriate non-surgical treatment. Many times the best treatment is not surgery at all. That is why education is such an important part of the process. I spend time reviewing imaging with patients, explaining the diagnosis, discussing reasonable options, and helping them make informed decisions based on their goals and expectations. My philosophy is simple. Perform exactly the amount of surgery needed to solve the patient's problem. No more and no less. Sometimes that means a minimally invasive procedure, or sometimes that means a more extensive operation is a better choice. The right approach depends on the individual patient and the condition we're treating. When minimally invasive spine surgery is appropriate, it can offer important benefits, including smaller incisions, less tissue disruption, and a faster recovery. But it is just one tool, not the answer for every patient. The goal is always to choose the treatment that best addresses the patient's problem and helps them return to the activities they enjoy.
The results are amazing. The following day when I woke up, I could feel my toes. I could feel my leg. I couldn't believe it because I was so used to not feeling my right leg because it was numb all the time, my foot, my toes. And as soon as I woke up, I was moving my toes and feeling them. So from that moment, I could just say that it was a success.
At Premier Orthopedic and Spine Group, spine care is built around careful evaluation, patient education, and individualized treatment planning, helping patients move forward with a clear understanding of their options. Are you asking people to repeat themselves or missing parts of everyday conversations? Hearing loss can affect more than sound. It can affect communication, confidence, and daily life. At Enhance Audiology, patients receive comprehensive hearing care from hearing evaluations to personalized solutions and modern, discreet hearing technology.
A lot of people think hearing loss just means sounds are quieter, but that is only part of it. Many patients can still hear someone talking, but the words are not clear, especially when there is a background noise. That is when conversations start to feel harder than they should. Many patients come in because their spouse insisted. They often don't realize how much they've been missing until they hear clearly again. Patients tell us how starting the treatment changed their life completely. It improved their relationships around the dinner table. It keeps them more independent. It improved their relationships with their friends and family. That is why a hearing evaluation can be so helpful. We're looking at how a person hears in real life, not just whether they can hear a sound. We test hearing, speech understanding, and the situations where communication is most difficult. From there, we can talk about what is going on, what options make sense, and how to support better hearing long term. If hearing aids are the right option, we spend time making sure they fit the patient's lifestyle. Today's devices are smaller, more comfortable, and more advanced than many people realize. They are not just about making sounds louder. They are about helping speech sounds clearer, making conversations easier, and giving patients support in the places where they actually need it.
At Enhance Audiology, hearing care begins with understanding each patient's needs and creating a personalized plan to help them hear and communicate more clearly. Millions of people now use technology like smartwatches, wearable health trackers, and AI to better understand their health. Together, they're helping us gather more information than ever before. Better information is making healthcare more personalized. So why are most dental visits still focused on finding problems after they develop? Dr. Tran Han believes dentistry is making that same shift, using better information to understand why issues develop before deciding how to treat them.
Dentistry has traditionally focused on treating problems once they appear. Today, we're asking a different question. Why is this happening to this particular patient? Why are their gums inflamed? Why do they keep getting cavities? Why are they losing bone? The answers are different for every person, and that's why gathering better information matters. My goal is to help patients keep their natural teeth healthy for as long as possible. That starts with identifying risk early before small problems become bigger ones.
At Mint Dental Loft, that process combines modern diagnostics and technology with a collaborative team approach.
Every patient's face tells the story of their growth and development. The way they breathe, sleep, and bite gives us clues about how they function. Their saliva helps us understand their microbiome. Digital imaging and AI helps us put those pieces together. That information helps our team understand why a patient needs treatment before deciding how to treat it. Saliva testing is a little like blood work in medicine. It helps us identify bacteria, fungus, and viruses in the mouth, giving us insight into each patient's unique risk profile so we can personalize treatment and help prevent the same problems from coming back. To me, oral health is an integral part of whole body wellness. The future of dentistry is understanding why problems develop so we can help prevent them before they become bigger ones. We use technology to help us understand the person behind the smile.
Mint Dental Loft reflects a broader shift toward dentistry that links oral health to overall health. Understanding why dental problems develop allows care to become more personalized, preventative, and focused on preserving natural teeth. Heartburn that keeps coming back may be more than just an inconvenience. At the practice of Siamak Tabib, MD in Los Angeles, patients receive comprehensive digestive care focused on early detection, effective treatment, and disease prevention. Dr. Tabib is board certified in gastroenterology and hepatology, as well as board certification in longevity and regenerative medicine.
A lot of people think gastroesophageal reflux disorder or acid reflux is simply something they have to live with. But chronic GERD should not be ignored. Common symptoms include frequent heartburn, regurgitation, difficulty swallowing, chronic cough, hoarseness, or even a feeling of something stuck in the throat. When stomach acid repeatedly irritates the lining of the esophagus, it can cause inflammation, and in some patients, changes called Barrett's esophagus. Barrett's esophagus can increase the risk of esophageal cancer. Treatment may include lifestyle changes, medication, or evaluation with an upper endoscopy. The goal is to improve symptoms, protect the esophagus, and identify concerning changes early.
Another important area of prevention is colon cancer screening.
Colorectal cancer is the second leading cause of cancer death in adults over the age of 50. However, it is the leading cause of cancer death now in adults under the age of 50. But it is one of the most preventable cancers. Most colorectal cancers begin as slow-growing polyps. During a colonoscopy, we can find and remove them before they become cancer. Colonoscopy can also detect cancer early when it is actually curable and, in most cases, treatable. Patients should talk with their physician about when to begin screening based on their age and risk factors. The guidelines and recommendations now recommend starting at the age of 45 for everyone. Because colorectal cancer may not cause symptoms early on, screening should not be delayed.
From managing chronic acid reflux to preventing colon cancer, Dr. Siamak Tabib focuses on early detection and proactive digestive care. C-Smiles Dental in San Pedro, California is a general dental practice led by Dr. Elias Khoury. The practice brings together preventative care, restorative dentistry, periodontal support, clear aligners, and advanced technology with a focus on helping patients feel informed and comfortable.
What makes our practice different is that we're able to look at the whole picture. We're not just treating one tooth or one problem. We're looking at the gums, the bone, the bite, the smile, the airway, and the patient's long-term goals. That starts with the basics, like cleanings, fillings, crowns, and preventative care. But gum health is a major part of that foundation. Our hygiene team uses tools like airflow and soft tissue laser to help manage gum health more effectively and make that care more comfortable for patients. For more complex periodontal needs, we also have a periodontist in the practice who can help with bone loss, gum recession, and implant-related concerns. Having that support here allows us to plan treatment more carefully and address problems before they become more serious. We also offer Candid Pro clear aligners, which can be a great option for busy patients. The cases are planned with orthodontic guidance, and patients can use at-home scan technology to help monitor progress between visits. I also like that Candid Pro focuses on creating proper space, which can be important for the bite, the smile, and in some cases, airway concerns. Technology helps us make treatment more accurate and more comfortable. We use intraoral scanners for digital impressions so patients can avoid the traditional goopy impression material. We also use cone beam CT imaging when we need a more detailed three-dimensional view for diagnosis and treatment planning. The goal is to make dentistry feel less overwhelming by helping patients understand their options, ask questions, and feel confident that their care is planned for both their immediate needs and long-term health.
At C-Smiles Dental, Dr. Khoury and his team use comprehensive care and modern technology to help patients feel informed, comfortable, and confident in their dental health. Pain in the ball of the foot can make standing, walking, and everyday activity uncomfortable. One possible cause is something called fat pad atrophy, where the natural cushioning beneath the foot becomes thinner over time. Dr. Dawn Barati is a board-certified podiatric surgeon with offices in Tarzana and Malibu. She has been perfecting plantar fat pad restoration for over 10 years, helping patients restore the natural cushioning of their feet and return to walking comfortably.
So the normal plantar fat pad of the foot is made up of chambers of fat separated by fibrous walls, and this creates a cushioning that's shock absorbing. But fat pad atrophy is a loss of that fat pad, and so you get thinning or a loss of the fat cells, and this causes us to put pressure directly on the bone and causes pain, like you're walking on your knuckles.
I felt like I was walking on rocks.
Plantar fat pad restoration is planned around the patient's symptoms, foot structure, and the exact area where cushioning has been lost.
The treatment for fat pad atrophy is to restore the function and the fat on the bottom of the foot. And this can be done using treatments that have been around for decades and used in the cosmetic world. So we're just essentially repurposing them and adapting them to this purpose. And by using a combination of filler and fat, we can recreate that architecture on the bottom where those chambers of fat are separated by fibrous tissue.
Oh my gosh, life-changing. So much more comfortable now. It's like a nice cushion. It's like a nice little cloud. There is no more burning. There is no more feeling like I'm walking right against the bone or walking on pebbles. I don't have to stick anything in my socks or shoes for comfort anymore.
It's life-changing. I mean, I would recommend it to anyone.
When I walk on it, I actually had to get used to that feeling. It's like bubble wrap under your foot. And it was like, oh, wait, that's like how it's supposed to be, right?
So for people who are suffering from plantar fat pad atrophy, restoration of the plantar fat pad can make a big difference in their lives. I really think we're onto something.
For Dr. Barati, fat pad restoration is about identifying where cushioning has been lost, restoring support beneath the foot, and giving patients another option when pain in the ball of the foot is limiting daily activity. If you missed any of the phone numbers or names mentioned in today's program, you can re-watch this Los Angeles edition on the American Health Front YouTube page.
Accommodations provided by the 4-star Hyatt Regency Los Angeles International Airport Hotel, offering travelers a seamless blend of convenience and comfort. Ideally located near LAX, SoFi Stadium, Kia Forum, YouTube Theater, iconic beaches, and many of Southern California's top attractions. The hotel features spacious guest rooms and suites, dining at Beckett's Kitchen and Lounge, a heated outdoor pool, and a fitness center with sweeping airport and mountain views, making it the perfect place to stay before or after any Los Angeles adventure.